Welcome back, everybody, and thank you for tuning back in. I'm going to see if I can pick up where I left off. Uh, and we were talking about PTSD and some of the symptoms of PTSD. Uh, there's so many symptoms of PTSD. Some people with PTSD will try to block out the memories that was associated with the event that happened to them. That's called repression. Okay, they may even destroy pictures from the past, that were taken in that time frame that the event happened to them, and so that's one way they distract themselves. They also try, excuse me, they also try to numb themselves. Okay, and what I mean by that is they try to numb themselves emotionally. They don't want to feel the pain anymore of the flashbacks and the memories and things like that. So they will work at numbing themselves to try to get through that. Some people get the jitters real bad. They suffer really, really bad jitters. And, when they do that, it's very hard for them to relax. They have trouble sleeping and things like that. This is called hyperarousal, okay? And with hyperarousal, the individuals can be very jumpy, always be on the edge, okay? And they end up making themselves feel stressed and angry, and makes it hard for them to do their daily tasks, and things like that. They also become very irritable, right? There's not a lot that won't set them off. They go through a lack of concentration because they're getting a lack of sleep. They're getting difficulties. They have difficulties maintaining relationships because it doesn't take much to anger them, to get on their nerves. That's where the irritability part comes in. And to go on, they have trouble. They have trouble on their job. They can't concentrate, so their work performance lags, starts to drop. Okay, and their employers recognize this, and they know there's a problem. But if the person don't want to talk to them about about what they're feeling and stuff like that, which a lot of times they don't want to talk to their bosses about that, and I understand that. You know, that's where medication can come in, because medication can help balance all that out, can help level that out. So it balances out your moods. It helps stabilize you. Some of the medications help stabilize you. As far as your anxiety, your fear to go places because you're afraid it's going to happen to you again. A lot of people become very vigilant when it comes to PTSD. They're always trying to be aware of everything that's around them. They lock the doors. They become aware of their surroundings. They're afraid that something is going to happen to them again, and that's actually called hypervigilance. Okay, you're always scanning the area. When you're in public, you sit with your back against the wall so you can see the door, so you can see everybody else in a restaurant or in a conference room or whatever, so that you know if somebody, so if you know that nobody's going to come at you, you can see them if they do. Okay, that's where hypervigilance comes in. thinking that you're always prepared. Okay? The problem is, excuse me, the problem is it's hard to be prepared because you don't know what's going to come at you. Okay? Uh, if it was a sexual assault, uh, you're sitting there thinking somebody's going to come at you and sexually assault you. Uh, that may not be what's happening. Okay? If anything. Most likely nothing is going to happen. But you're always on your guard. Okay? You're always on your guard for just about anything that's going to happen. Another problem with being on your guard like that, constantly on your guard like that, is it can irritate people. They're watching your actions and stuff like that. Uh, they can become irritated or agitated, thinking that you're going to freak out on them or something like that. Something you're going to do something. Okay. You can have somebody, if you're, say, like if you're in a restaurant, you're sitting with your back to the wall, your eyes are darting around, you're scanning the room, you're watching everybody, and somebody comes walking from a bathroom, and you see them in your peripheral vision, you may attack that person, and that person hasn't done anything to you. Okay, so being what they call hyper vigilant can be a problem. Okay, so if you're experiencing any of these things that I've been discussing, as far as PTSD symptoms, being easily startled, somebody comes walking up past you and you jump, things like that. Those are all good signs that you possibly have PTSD. Uh, now, now don't get me wrong. So-called normal people that are out walking around, window shopping, walking through stores and stuff like that, somebody can come walking past you pretty quick and kind of startle you. Okay, but that's something that's going to pass. I mean, okay, you're startled now. Give it a little bit of time. You start relaxing back down and becoming your normal self. Okay. However, people with PTSD don't react that way. They don't after a couple of minutes or an hour or two start relaxing back down and becoming themselves, because they're always on guard. They're always watching. And so when somebody comes up from behind them like that, that's going to give them a pretty good jolt, and that can send them back into. They may go back into flashbacks. Okay, they may go back to seeing the event that happened to them coming up again, and they may quit shopping and turn around and leave the store rather quickly. To get to their vehicle where they can lock the door and think they're safe, and maybe get home, get inside and lock the door and think they're safe. Okay? With anybody with PTSD, if they have a weapon in the house, that can be dangerous, because not only can and may use it on themselves, they can and may use it on anybody else in the house. Okay? So these type of things are reasons why I stress, go see a professional. All right? If you have to take meds, take your meds. Learn some coping skills. Try to learn how to deal with this situation that you're in. Try to learn how to deal with this disorder you're in. Okay, and a lot of times medication can be a big help. And it depends on what type of medication they give you. And they're developing new ones every day. Uh, some are better than most. Okay? I know that that type of life, living that type of life with PTSD can be very, very hard. It can be very hard to cope with. It can be very stressful for you. Uh, it can cause other illnesses from all the stress, all the anxiety, all the depression. It can affect your body in so many different medical ways. Okay? Uh, so I really do stress getting some professional help. And if it's not you, if it's a friend of yours, I stress so hard that you try, try to talk them into seeing if they can, try to talk them into seeing somebody. You know, let them know you care. Let them know you care about them. Let them know you want to help them help themselves. And a big problem with a lot of people say, well, I'm going to help this person, that person, or the other with these problems they have. And I'm going to help fix them. And you can't fix anybody. You cannot fix anybody but yourself. Okay? If it's a friend, the only person that can fix that person is him or her. Okay? If they're willing to seek professional help, you can help them along. Sometimes they may want you to go with them. Fine. Take a day off of work or whatever. Uh, spend a couple hours. Go with them. You don't have to be sitting in on the session unless they want you to. If they want you to, then you ask the professional that you're talking to and see if the professional will allow it. Okay, so there's many ways that you can help somebody, but never think that you can fix them. Okay? Never think this person is broken and I can fix it, because you can't. All right? It's impossible. There's no way you can fix it. Like I say, the only one you can fix is yourself. And if you realize that you have any of these problems and you decide to go see a professional, you're taking the first steps of fixing yourself, helping yourself. Okay? Is it curable? I would say it depends on how severe the situation was that you were in, how severe the experience was that you were in. Like I said before, some people let's say they see a fatal car accident, okay, and they run over to assist. If that's what happened to you to cause your PTSD, okay, the person that went over there with you to help you, try to help, they may not get PTSD. You want to know why? I cannot tell you that. It still is not, they still haven't found out why some people get it and some people don't. Some people, it's just like a normal everyday experience. They experience this. They finally left that situation and went on about their business. They probably dreamed about it for a while, a few days, a week, a month, or whatever, and got through it. Okay, and you didn't get through it. Well, there could be several reasons for that. You know, it's not like I've said before. It's not that you're weak or weak-minded or anything like that. Everybody perceives things differently. Okay? So that may be why you developed it and they didn't. All right. You can have 5 people see a fatal accident and maybe 2 people come out of it with PTSD, or maybe more, maybe less that don't. That's hard to say. But what I mean by how you perceive it, how you perceive things, how everybody perceives things differently, those same 5 people can give their account to the police of what they've seen happen, and each one of them be a different account. For one of the biggest reasons for that is most people see things from different angles. Okay, so they perceive it differently of what happened. I'm trying to wrap this up, so I'm trying to figure the best way to do that, because I haven't talked about this in a long time. Like I say, if you have any of these symptoms, think you have any of these symptoms, or actually have any of these symptoms, go seek a professional. As I've said before, do not self-medicate. It's 9 times out of 10 just going to make the situation worse, okay? Seek a professional, get the help you need. Probably in my next video or videos, most likely I'll give you some ideas of some coping skills that maybe you can learn to use if you're, if you have PTSD. If you go and seek professional help, I'm sure that I know that they're going to teach you some coping skills to go along with medication and therapy, because you're definitely going to need therapy. And like I said, don't feel afraid to talk to anybody. I just lost 2 family members just a week ago on the same day. Very depressing, very sad. But I'm coping with it. My coping skills for things like that is throwing myself into my job, or into cleaning the house, or working outside around the house, and just throwing myself into it and going for it. Spending as much energy as I can to do it. Sometimes I'll just build something, anything. It helps me relax. I love to fish. Fishing helps me relax. I think it helps me relax more than anything. Okay? So anyway, seek out a professional. If you have these symptoms, any of these symptoms over a few months, go see somebody. Talk to somebody. Okay? I'm not saying they're going to throw you on medication. They will evaluate you, figure out what the severity is, and then they will determine therapy from that. Okay, whether it's give you medication or just teach you some coping skills to learn to cope with your situation, and to give you the therapy. The therapy is one of the best parts, because you can talk about it. Okay, and as long as you feel comfortable with your therapist or psychiatrist, whichever, as long as you feel comfortable with him or her, you're more apt to talk about it. Okay, the more you talk about it, the more release you get from it. Okay, I mean, you don't have to go and talk to your family members and stuff like that. You don't have to go talk to your boss. Most people don't like talking to their bosses that much anyway, especially talking to them about their personal life. So, with all that being said, finally, I'm going to shut this one down, okay? And again, thanks for watching my channel. leave me a comment. If you leave me a comment, I will reply, okay? So leave me a comment, subscribe. There's going to be much, much more, and every video I get into, I'm going to kind of backtrack onto a little more information on what I have been talking about, like I did with my self-esteem, and just keep it going, okay? I don't want to try to do too many of them at one time, side by side, because it's going to get really confusing, okay? So anyway, like I say, leave me a comment, subscribe, hit that bell, and I'll say bye-bye. Have a great day or evening, whichever you're into already. Thank you.